take me back to, life before your diagnosis. What was it like in the lead up to coming and getting checked out?
Well, we had bought a house in Amargosa Valley, and I was working a lot. I worked for the Nevada Department of Transportation. Great job, great place to work, highly recommend it. And I was, I guess, doing what most middle-aged, 40-year-old, 45-year-old men do. They work and they try to take care of their families and go out on the weekends. And times I felt like I was kind of a chaos coordinator, but I really enjoy the job too. So yeah, I grew up in Massachusetts, and I guess I had a very typical Massachusetts upbringing. I played hockey a lot, played soccer, went to the University of Massachusetts, and I joined the Army after got stationed in Germany, and I had a great time. And after I got out, I moved to Nevada, and I had some other jobs, but eventually I wound up at the Department of Transportation. And so, yeah, it was unremarkable, but it was also remarkable because, it was my life and it was exactly what I wanted it to be.
Yeah, well, first off, thank you for your service. And two, now fast forward me to when you first show up in Dr. Friedman's office, and you hear the word cancer. Just what was going through your head then in terms of what life was going to look like?
Well, I thought, St. Peter, here I come. This is pretty much it for me, It was devastating to hear, but I knew I had to be strong for my wife and my son and my family and my friends. So I did my best to compose myself and keep myself together. And I was in a lot of pain, obviously, because I had a 8-centimeter tumor in my colon. And Dr. Friedman immediately realized that I have to put an ostomy on my colon. That's where they take it out of your body and you expose it so that it bypasses the tumor. You don't use your rectum or anything like that. And that was a big shock for me, to go from who I was before to having to go to the bathroom in a bag. And I had a catheter in me also. So it was a big change, for sure. And, I lost a lot of weight. I was literally dying when I saw Dr. Friedman. And, thankfully he did all the right things. He made sure I had a chemo port in too, so that you can do chemotherapy through the port, which helps out a lot. And I don't think I could have even walked up the stairs here. I was so weak. So not in very good physical condition at all.
Yeah, and like you said, everyone hears the word cancer and they think that's it. But can you talk to me about that process of working through it and what that looked like in terms of getting you back to where you are today?
Well, the normal treatment for colon cancer is they give you sort of a cocktail of chemo drugs, leucovorin, oxaliplatin, or irinotecan, and a pump called 5-FU. And I'm not gonna lie, the chemotherapy was pretty brutal. It is. It's. I had pretty severe nausea, but it also worked. And I think that's another message people need to understand when they hear chemotherapy. They think it's, it is, it's rough. I'm not gonna lie to you, it's very rough, but it also works. And in my case, it really shrank the tumor in my colon enough so that Dr. Friedman was able to operate on it. And Dr. Selleck, his partner, was able to treat those little spots in my liver. And it's been a slow road to recovery, but he was, thankfully, the cancer is gone. I'm in remission, and he was able to reverse the ostomy, so I just have a little scar from where my bag used to be, which is great.
Yeah, and you mentioned there now you're in remission. Just can you talk to me about you know, to be on the other side of it now, those emotions there, and you know what life is like at this point.
You know, I know there's a lot of people when they first hear the diagnosis, they're obviously in a very dark place. I know I was. It's pretty brutal to hear, but I think it's very important people understand that you absolutely can survive. You know, I'm never gonna be free of cancer, but I can live with the cancer, and it's not gonna dictate my life all the time. That's really what you're trying to do. You're trying to coexist with this monster that is inside of you, and it is possible to do that. You know, you can go through the treatment and go through the surgery and the rehabilitation and absolutely get to remission. Even with stage 4, it's still very possible. You know, I think the staging it's one of several factors that go into this. You know, people can't get hung up on whatever stage it is, because there's too many variables to say how well you're going to do. But from where I was when I first got diagnosed, I couldn't even go out to get the mail. I was that weak. And to now, I've pretty much resumed most of my activities. I even started working out again with these little baby arms, or, you know, trying to still stay in shape and whatnot. So it is absolutely possible to get your life back. People have to understand that.
Yeah, and you talk about, you know, trying to get the message out there to people. Just how special of an opportunity is it for you now to, you know, share your story in the hopes of getting other people out there willing and able to go and get checked?
Once that polyp or cell turns cancerous in your body, it's over. You're not going to ignore it. You're not going to beat it on your own. It will eventually grow into a giant tumor and kill you. And you have no choice. At that point, you know, you're a cancer patient. The whole idea with the colonoscopy is that they can treat you before it ever gets to cancer. Those polyps can be in your colon for years, and then one day they just turn cancerous. So that's what they look for. They look for any signs of cancer and, you know, cancerous polyps. But if you can avoid what I've had to go through, it's very important that you want to do that. It's a very simple procedure. The worst part is the night before. It is, but the procedure itself is very easy. I've had several of them done. It's literally half an hour and that's it. You know, it really can save your life. It's very important that people take it more seriously and start doing them.
Yeah, you know, in talking with Dr. Friedman, you know, we're starting to see colon cancer in younger patients, and now the guidelines in terms of age to go and get a colonoscopy is being updated. I guess, what age were you when you were diagnosed?
I had just turned 47.
47. So
it was not anything I would have ever expected. And they did do fairly extensive genetic testing on me. They think maybe they found a link, but there was no smoking gun. There was no Lynch, there was no BRCA, there was none of the other common genetic markers for cancer. So, you know, there's a lot of people that they don't think genetics are really necessarily as big a role in it. It's more lifestyle that determines it. And genetics doesn't explain why so many young people are getting diagnosed with colon cancer, or young women that don't smoke and they're getting lung cancer now too. So definitely something I think we need to investigate a lot more.
Yeah, and you know, when you talk about that, obviously, you know, what would you want people to take away from your story? What would you want them to, one, know about you, and then two, apply that into their lives?
Well, when you have cancer, you get a PhD in pain and suffering. I did not know it was possible for a human being to be in that much pain and still be alive. I would have never thought it was possible. I did not realize that you can be so weak that you can't even go out to get the mail. And I want people to understand, I have no idea why this happened to me. But if there's anything you can take from it, you don't want it to happen to you. And if that means that, you have to go and get a colonoscopy done, get a colonoscopy done. At least you've eliminated colon cancer. And please, it's not something that you're going to beat. You can't ignore cancer or run away from it or anything like that. It will kill you, So please get your colonoscopy done.
Yeah, my final question, obviously now being on the other side and being able to still be there with your family, just those emotions, because obviously it's, a bit of the unknown when you first get that diagnosis, like you said, and to still be there alongside them and have them in your life. What are those emotions like?
I take just being able to go outside without an ostomy bag on you, being able to drive a car on your own, being able to go grocery shopping by yourself. Those are things I could not do for the longest time. And my family, I don't think I would have made this through it without them. There were nights when I was on the couch and my wife would stay up with me, and she'd hold my hand and we would talk, and she would get no sleep, and then she'd have to get up and work for 9 or 10 hours the next day. And my son would help out too. I can't imagine having to go through this alone. I don't know how somebody deals with that. I don't think I would have been strong enough to get through it on my own without that support network. And people have to understand, that you're not alone. There's a huge network of supporters and former patients and survivors that can help you. So don't be afraid to reach out, for sure.
Yeah, and obviously here at Mountain View and in their systems, just your relationship with Dr. Friedman and staff here, just how was that like for you?
Dr. Friedman's amazing. He's literally an angel, gives people like me a second chance at life. And my whole family and everything, we owe Dr. Friedman a lot. And I think he also roots for the patients. You know what I mean? I sometimes when you go and see a doctor, you don't really get that impression. You know what I mean? They're just like, oh, okay, well, we'll give them whatever to get them out of here. But Dr. Friedman's he's not like that. He really wants his patients to succeed. And he's given me another lease on life. So I'm obviously very grateful for him and for his partner, Dr. Selleck, and for the staff here at Mountain View. They're amazing.
Yeah, my last question is the same last question I ask everybody. If there's something I didn't ask you about directly that you wanted to make mention of, the floor is yours. Whether it be about colon cancer, life in general, anything.
If there's one thing that I learned in all this, you've got to make every moment of your life count, because you never know when your number's going to come up. Last thing in the world I ever thought was I would be diagnosed with colon cancer at 47. Did not see that one coming. And that's what I try to do now. I literally try to make every moment of my life count, because I don't know how much time I have left. I don't know if it's months or years or decades. I don't know. But for people that, I don't think they understand the concept of mortality. We're only dancing on the earth for a short time. And if you had to leave tomorrow, would you really be happy with your life? So at this point now, I can honestly say, yeah, I am. I don't know if I could have said that before the cancer. It was a life-changing event for sure, but don't waste your life. You only got one. You really need to make it matter and make it count. And also, my father is, he watched his family members suffer with cancer too. And death can scar you in a lot of ways. I don't really think you're ever going to get over losing a loved one, but you always take the memories that they have and you try to apply it to your life. And that's what I try to do with some people that have passed. If they were still here, what would they want me to do? And that's what I try to do, you know, because I don't think anybody's really dead if they live on in your memories. You know, you don't really die. So that's my philosophy here in a bottle of life.
And I'm so sorry, I don't know if you guys covered this. Were you having any symptoms, John? I know
Oh, yes. Yes, you probably should talk about that.
Yeah, because I know you had told me you weren't having like any symptoms,
Right.
and then all of a sudden, just one day at work, you collapsed. So
Yeah.
I wanted to make sure there was a little bit of that in there.
There were, I was on my birthday. I just literally woke up that day and felt terrible. And I had violent hiccups, like to the point, I'd never had hiccups like this before. Well, that's because liver metastasis, that's what they do. And I was very weak. I was napping for like 2-3 hours during the day. I thought I had the flu or something, you know. I would have never thought it was cancer, but this felt different. And it did go away, and I went back to work, and for like 3-4 months, and I don't know, I was going downhill, but I was working 11-12 hours a day with stage 4 cancer. Like, I was operating heavy equipment and went on a hydraulic roller and with a giant tumor in me. And I don't know how I was doing that, you know, but I didn't have any of the traditional, like, bleeding from your rectum or bloody stool or anything like that. I was losing weight and I was weak, but there really wasn't anything that pointed to colon cancer. I even used the chatbot to try to diagnose myself. And colon cancer was there, but it was like way down at the bottom of the list, you know, so you don't really think about it. Sometimes there are no symptoms, you know, and my tumor was a good size, but some people have tumors that are like 20 centimeters or more before they finally get to a hospital and get scanned. So it all depends on how it grows in your body and what it interacts with, that you may not have any symptoms. It's very possible. Sure.
And looking back at your experience, because I know you talk a lot about your family, and this was a very trying time for you.
Mm-hmm.
Looking back, what are you the most grateful for?
Well, obviously still to be here and to be alive, and, you know, to be able to talk about it. But I'm in the cancer battle now, whether I want to be or not. So I guess in a way I'm grateful to be able to talk about it and to try to help other people with colon cancer, you know, to get through it. Because I know it's hell. It is. It's a very difficult time, especially for a young person, you know. So if I'm given the opportunity to help people with colon cancer, I absolutely will do it. I know Dr. Friedman and his staff are doing everything they can also. But my life took a very drastic turn, and this is where I am now, you know. So to be here and to still be alive and to be able to help people get to this point, that's what I'm grateful for, any way I can.